Good day, Miss A. I'm Eliza Nicole M. Tasoy from BSC 1-1, and my report is consisting of two topics, which are the maternal deprivation in the attachment theory, which is both made by John Bowlby. I will gonna discuss first the maternal deprivation. The picture that is being shown is Edward John Mostyn Bowlby, or known as John Bowlby, was a British psychologist, psychiatrist, and psychoanalyst, notable for his interest in child development and for his pioneering work in attachment theory, which is also one of the topics that I'm going to report. But then, before anything else, what is the clear definition of the deprivation? It is subjected to deprivation if a primary attachment figure is present but unable to provide the care to the infant or a child. Bowlby used the term maternal deprivation to refer to the separation or loss of the mother as well as failure to develop an attachment. But some people gets confused to the deprivation and privation. Deprivation and privation is different from one another. Deprivation is when you have formed a relationship to the caregiver or the mother and became separated to it. And the privation is that you don't have any connection or you don't receive any care. Maternal deprivation is one of the early theories made by Bowlby, which is made before the making of the attachment theory. It is a scientific term summarizing the early work of John Bowlby on the effects of separating infants and young children from their mother or a mother substitute in a period of time in their early childhood, which can cause serious consequences. It focuses on how early experience could affect or interfere with the usual process of attachment formation in a negative way. Although Bowlby did not rule out the possibility of the other attachment figures for a child, he did believe that there should be a primary bond which was much more important than any other, which is usually the mother. It is the idea that continual presence of a mother or a mother substitute is essential for normal psychological development of babies and toddlers both emotionally and intellectually. Also, according to Bowlby, the first 30 months or 2 years and a half of life is considered to be the most critical period. That if a child experiences maternal deprivation for that period of time, psychological damages may occur inevitably while growing up. If the attachment period figure is broken or disrupted, during the critical 2-year period, the child will suffer irreversibly long-term consequences of this maternal deprivation. He also believes that the continuing risk of psychological damage is up until the age of 5. Bowlby's maternal deprivation hypothesis suggests that continual disruption of the attachment between infant and primary caregiver or a mother that could result in long-term cognitive, social, and emotional difficulties for that infant. According to him, there are two main effects of it on the development of an infant. The first type of effect is the effect on the intellectual development that can experience delayed intellectual development and also have a low IQ level, or just some people who are having a slow wit or slow understanding. Another one is the emotional development. They can have the affectionless psychopathy or the inability to feel guilty or to show some strong emotions towards the others that prevent a person to have a normal relationships. And also the crime of a minor or the delinquency is also present in this time of effect of in development. It is because they don't appreciate the feelings or can feel any remorse for their actions. The 44 Thieves study is made because Bowlby believed that disruption of this primary relationship could lead to a higher incidence of juvenile delinquency, emotional difficulties, and antisocial behavior. To test his hypothesis, he studied 44 adolescent juvenile delinquents in a child guidance clinic. Its aim is to investigate the long-term effects of maternal deprivation on people in order to see whether delinquents have suffered deprivation. The procedure happened between 1936 and 1939. An opportunity sample of 88 children was selected from the clinic where Wolby worked. It involved 44 juvenile thieves, which are referred to him because of their stealing. Bowlby selected another group of 44 children to act as controls, or the individuals referred to the clinic because of emotional problems, but not yet committed any crimes. Upon their arrival, each one of them will have their IQ tested psychologist, who also assessed the child's emotional attitudes towards the tests. At the same time, the social worker interviewed a parent to record details of their child's entire life, especially the periods of separation. After that, Bowlby then conducted an initial interview with the child and the accompanying parent. The conclusion Bowlby made is that Bowlby concluded that maternal deprivation or deprivation in the child's early life caused permanent emotional damage. He diagnosed this as a condition and called it affectionless psychopathy, which according to him is a condition involves a lack of emotional development characterized by a lack of concern for others, lack of guilt, and ability to form a meaningful and lasting relationship. The next and last topic that I'm going to discuss is the attachment theory. Attachment theory is a psychological, evolutionary, and ethological theory concerning relationship between humans, which is the most important tenet is that young children need to develop a relationship with at least one primary caregiver for normal social and emotional development. The central theme of attachment theory is that primary caregivers who are available and responsive to an infant's need allow the child to develop a sense of security. The infant knows that the caregiver is dependable, which creates a secure base for the child to then explore the world. Bowlby proposed that attachment can be understood within a evolutionary context in that the caregiver provides safety and security for the infant. Attachment is adaptive as it enhances the infant's chance of survival. The attachment theory argues that a strong emotional and physical bond is to one primary caregiver in our first lives of life is critical to our development. If our bonding is strong and we are securely attached, then we feel safe to explore the world. If our bond is weak, we feel insecurely attached. We are afraid to leave or explore a rather scary looking world because we are not sure if we cannot return. The Ainsworth strange situation. In her 1970s, research psychologist Mary Ainsworth expanded greatly upon Bowlby's original work. Her groundbreaking strange situation study revealed the profound effects of the attachment on behavior. In the study, researchers observed children between the ages of 12 and 18 months as they responded to a situation in which they were briefly left alone and then reunited with their mothers. And based on the responses that the researchers observed, Ainsworth described three major styles of attachment. Number one is the secure attachment, which is, according to Ainsworth, securely attached infants are easily suited by the attachment figure when upset. Infants develop a secure attachment when the caregiver is sensitive to their signals and responds appropriately to their needs. The next one is the ambivalent insecure attachment. The child fails to develop any feelings of security from the attachment figure, and they do not seek contact with the attachment figure when distressed. And the last one is the avoidant insecure attachment, which is the child will commonly exhibit clingy and dependent behavior, but will be rejecting of the attachment figure when they engage in interaction. When distressed, they are difficult to soothe and are not comforted by interaction with the attachment figure. This behavior results from an inconsistent level of response to their needs from the primary caregiver. Researchers Rudolf Schaffer and Peggy Emerson analyzed the number of attachment relationships that infants form in a longitudinal study with 60 infants. The infants were observed every 4 weeks during the first year of life and then once again at 18 months. Based on their observations, Schaffer and Emerson outlined four distinct phases of attachment. The pre-attachment period. From birth to 3 months, infants do not show any particular attachment to a specific caregiver. The infant signals, such as crying and fussing, naturally attract the attention of the caregiver, and the baby's positive responses encourage the caregiver to remain close. The next one is the indiscriminate attachment. Infants develop trust the caregiver will respond to their needs. While they'll still accept care from others, infants start distinguishing between familiar and unfamiliar people, responding more positively to the primary caregiver. The third one is the discriminate attachment. At this point, from about 7 to 11 months of age, infants show a strong attachment and preference for one specific individual. They will protect when separated from the primary attachment figure. The last one is the multiple attachments. After approximately 9 months of age, children begin to form strong emotional bonds with other caregivers beyond the primary attachment figure. This often includes the father, older siblings, and the grandparents. And that is all for my reporting. Thank you, Miss.